everybody, and welcome everybody back to the room. And in today's program, we have two presentations. The first one, that is the femto Lasik and the correction for myopic astigmatism, and the second one relating to femtosecond also. And as I had said, we better cut off one because the time is limited. And next week, Dr. Vanang will come to France, in Paris, for studying for 1 year. So congratulations for your scholarship. And now we start with the first presentation, and that's the only one presentation today, that's the femto Lasik and the correction of myopic astigmatism. So welcome, Dr. Vanang.
Dear entire professor and doctor, my name is Vanang. I'm a resident in the second year. Today I present my research named Outcomes of femto Lasik for myopic astigmatism correction. This research was conducted under the instruction of Dr. Kung Hong Seo. Currently, corneal laser refractive surgery is the most used method to correct various types and decrease of refractive errors. The improvement of technologies and innovation continue at a rapid pace. And for Lasik flash creation, the femtosecond laser has become a rapidly and widely adopted technology to enhance the precision, safety, and clinical outcome of the procedure. Femtosecond creates a flash board file to deliver more accurate flash with uniform thickness and reduce incidence of flash complication compared to microkeratome created flash. However, several research were carried out on myopia, but few on myopia astigmatism. That's the reason why I conduct this research for the purpose to evaluate the result of femto Lasik surgery for myopic astigmatism corrections, and secondly to remark several factors related to result of surgery. Astigmatism is a refractive error which the parallel rays of light entering the eye through the refractive medium are not focused on the single point. There are two main causes: is a corneal factor and non-corneal factor. Among corneal factor, we divide into regular and irregular astigmatism. Regular astigmatism is in principle meridians are perpendicular, and irregular astigmatism, the principal meridians are not perpendicular, which is often associated with the prior ocular surgery or trauma or keratoconus. The classifications of astigmatism divide to three groups: low astigmatism under 1.5 diode, the moderate from 1.75 to 2.75 diode, and higher 3 diode. The myopic astigmatism is one of types of astigmatism, includes simple myopic astigmatism and compound myopic astigmatism. And the classifications include three groups: the low myopia under 3 diode, moderate and 3.25 to 5.75 diode, and high myopia and higher 6 diode. The refractive power of cornea is 43 diode, and corneal thickness at the center is 0.5 mm, and periphery is 0.74 mm. The radius curvature 7.5 to 8 mm. The surface of cornea divided into four zones: the central zone, paracentral zone, peripheral zone, and limbal zone. The structure of corneas includes five layers: epithelium, Bowman layer, stroma, descendant membranes, and endothelium. The femtosecond laser have low pulse energies and high pulse frequency energies, so the spot size and spot separation is very small. The mechanism of action, the principle of photo diffraction. The laser energy is absorbed by tissues which result in plasma formations, which cause shock waves, and the expansions of plasma create cavitations bubble which separates the tissue back. So that makes a difference between excimer laser and femtosecond laser. The excimer laser precedes a superficial effect. In contrast, the femtosecond laser precedes deeper effect. And compare micros and femtosecond laser, we can see some advances of femtosecond. Is no micro shockwave, no mirror tissue, no heat transfer, and no damage in surface. Materials and methods. 72 eyes from 41 patient myopia astigmatism undergoing femtosecond LASIK surgery from July 2019 to April 2020. The inclusion criteria is age of 18 to 39 years old. Sphere value range from 0.5 diode to 10 diode. Selling the value range from 0.25 to 5 diode. Discontinue contact lens for 2 days with soft lens and 2 weeks with hard lens prior to assessment, and stable myopia for at least 12 months. The inclusion criteria is the corrected distinct visual acuities under trend on 30, coexisting ocular systemic disease, history of hepatic keratitis, corneal dystrophy and scarring, post-operative corneal stroma test under 250 micromet, and myopia higher 12 millimercury. The methods of research is a prospective study with this formula. I calculate we need at least 59 eyes, and our research have 72 eyes. This examination equipment, the auto-refractometer, medic, and surgical equipment, the vision mark and 90. The surgical procedures include 5 steps. Firstly, the femtosecond laser creates the corneal flash. Then the patient is moved to the excimer laser. The third step, the surgeon opens the flash and fold it back to expose the lower corneal layer of this. And the fourth step, the excimer laser applies the pre-calculated amount of corneal tissues point by point. And finally, after the laser surgery is complete, the flash is returned to its original position, then adhered in the original place over time. The data collection includes 8 genders, visual acuity, refraction, pre-operative and post-operative, the central corneal thickness, power of cornea, the time of evaluation, 1 week, 1 countries and 6 months post-operative. The statistical analysis is SPSS software. A total of 72 eyes from 41 patients were recruited, and 51% were male and 49% were female, with a mean age of 20 years old, range from 18 to 39. The group of age from 18 to 22 account for the highest rate, with 83%. The mean pre-operative UTPAs were 1.31. The mean operative spiral was 4.84 diode, range from 0.5 to 9.75 diode. The group of moderate myopia have the highest rate with 49%, and then followed by the high myopias and the low myopia. The mean size was 1.09 diode, range from 0.5 diode to 2.25 diode, in which the proportion of low astigmatism is dominant with 85%. Moderate astigmatism is 15%. This result is similar to the other research. The pre-operative central corneal thickness is 542 micrometers, and corneal power is 43 diode. At 1 week, the proportions of eyes achieved UDPA 20 on 20 were 40%, 20 on 25 were 86%, and 20 on 30 were 97%. At 1 month, the proportion of eyes achieved 20 on 20s increased to 58%, 94% at 3 months, and 97% at 6 months. This result is similar to other research. And post-operative refraction was decreased and stable at 3 months. This result were similar to those of Niparus at 6 months. Compared to research of James, our research were better, which can be explained that our mean pre-operative spiral were lower. And this is the post-operative corneal central corneal thickness and corneal power is stable after 1 week. At 1 week, 1 and 3 months, the low to moderate myopia have better visual acuity, but no difference at 6 months. So finally, both low to moderate and high myopic have the same outcome, but patients with high myopia need more time to recover. This result is similar to research of Turkey. Compared to research of Hashimi and Vestera, our research is better, but the research have a patient with pre-operative spiral higher than ours. Post-operative UDPA at 1 week have a difference between 3 groups, but after 1 month, no difference between these groups. Post-operative UDPA between low and moderate astigmatism have no difference at all follow-up visits compared to research of waiting with about the outcome of Lasik surgeries. Post-operative visual acuity were different between low and moderate astigmatism. So compared to Lasik surgery, femto Lasik have a better outcome at moderate astigmatism group. The low to moderate myopia have better post-operative regression. This result is similar to research of Turkey, Hashimi, and Vestera. Post-operative astigmatism value were similar between low and moderate astigmatism at all follow-up visits. These results were similar as a research. And in conclusion, for the first purpose, evaluate the result of Lasik surgery for myopic astigmatism corrections. Firstly, 83% eyes achieved UDPA better, 20 on 20s, 94% eyes achieved UDPA better, 20 on 25 post-operation at 3 months. Secondly, post-operative means SE were 0.32 diode, means spire were 0.49 diode, and means cylinder were 0.32 diode at 6 months. Post-operative central corneal thickness were 440 microns and corneal power were 38 diode. For the second purpose, to remark several factors related to result surgery, the relation, the post-operative UDPA between refractive group, the low to moderate myopic group has a statistically significant better UDPA at 1 month and 3 months, but no difference at 6 months. The low to moderate astigmatism group has no different post-operative UDPA. And post-operative refraction between refractive group, the mean post-operative SE were better in low to moderate myopic group at every follow-up visit. The post-operative cylinder were not different between low and moderate astigmatism group. Thank you for attention.
So what about disappear? Thank you for staying here with us, Dr. Van Anh, Dr. Tuấn, Dr. Zhang, Dr. Song. Is there any question for Dr. Van Anh? Any question or comment? I'm sure Dr. Sun may have some question. You may have. While waiting for the questions, I have a question for you, Dr. Van Anh.